Hello and welcome. My name is Barkha Dutt. You're watching the Mojo Story. As some of you know, we have been for the past 2 weeks and more on the ground in rural India, actually tracking India's uncounted COVID deaths. After visiting six different places along the river Ganga, we have been arguing that these deaths are vastly underreported. We have not just seen a pile up of mass graves, we have also seen in villages people are dying at their homes, undocumented, unchronicled, and in fact unacknowledged. In fact, recently we were just taking a boat journey down the river Ganga. We have those pictures and that full report on our channel. And one of the things that the boatman said to us, right, the boatman who was taking us down the river, said to us was that he had never seen these many bodies in his life. The reason I'm bringing up the story of this one boatman, and I can bring you many local testimonies, is because of the furious debate around how many infections there actually are in India and how many deaths there actually are. And this becomes really important because the government has now gone on record to say that the second wave is diminishing. It's on its way out. But we can only make that point if we trust the data. Can we trust the data when the deaths and the cases in rural India are not being counted? That will be the focus of our broadcast today. And to give you a sense from the ground, let me just play for you one of the, the hundreds of local testimonies I have about the surge in bodies, the surge in deaths that are taking place in rural India. This was one boatman as we went down the Ganga River.
For many days now, we have been tracking India's uncounted COVID bodies, India's the kind that you see by this riverbank. We're in a boat right now and we're about to travel down the Ganga River from this ghat, the Mehendi Ghat in Kannauj, to the Nanamu Ghat, which is 30 kilometers away. So let me give you a sense of where we are. First, if you come this side, you will see many bodies of the kind that we have been showing you from different parts of Uttar Pradesh. Uttar Pradesh की सरकार से अभी तक कोई इसकी एक तरह से ठीक एक्नॉलेजमेंट नहीं आई और हमें बताया भी जा रहा है कि यहाँ पर लोग कह रहे हैं कि हमने कभी भी इस तरह के दृश्य नहीं देखे। हाँ, हो सकता था पहले कुछ जिसको कहते हैं मिट्टी आती हो, कुछ लोग छोड़ जाते हो, लेकिन इस तादाद में, इस संख्या में आप जहाँ देखें आपको दिखेगी कि नई रेत और वहीं पर in the absence of dignity even in these moments of death, अगर आप देखें तो you'll see stray animals right next to the bodies, dogs and other animals too. उस तरफ भी मैं आपको दिखाऊं तो आपको वैसे ही दृश्य मिलेंगे. And behind we have already shown you from the ground the kind of numbers there are. As we've said, I have personally counted 1,000 and more bodies in the 5 locations I've been to. Let me recount them for you. Unnao, Kanpur, Prayagraj, Varanasi, and now here in Kannauj. And we are leaving this ghat and we are going to be undertaking this long journey. It's going to take us 2 hours by boat according to the boatman to get to the next ghat. और भैया जी, अब मैं आपसे कहूँगी कि थोड़ा मोटर आप चला दीजिए और हम आगे चलते हुए बनते हैं. और थोड़ी देर आगे यहाँ पे मैं आपको दिखाऊँगी, हमारे साथ मयंक भाई हैं और मयंक भाई यहाँ घाट पे एंट्री करते हैं और वो हमें बताएंगे कि क्या फ़र्क है आज और पहले में. क्योंकि बहुत लोगों का कहना है कि भाई कोई फ़र्क नहीं है, ये तो पहले भी होता था. और वो बहुत लोग ज़्यादातर सरकार के समर्थक हैं या सरकार के नुमाइंदे हैं, लेकिन क्या ये सच है, हम मयंक भाई से पूछेंगे. आप देख सकते हैं कि जैसे हम गंगा पर सफ़र करते हुए जा रहे हैं तो गंगा के तट पर क्रिमेशंस जारी हैं. We are seeing a number of cremations as villagers talk about a surge in the deaths that are taking place in their villages. But these cremations, and I'll just ask the camera to go there again, these are cremations where the families have accompanied the bodies. And there are 2 kinds of last rites, in a sense, that are taking place at these ghats. One is, of course, where you have the families accompanying the body, and the other is where the bodies are being completely abandoned and they're being left, as we've said, buried in the river banks, in the रेत, in the sand. तो मयंक जी हैं हमारे साथ, और मयंक भाई आप समझाइए हमारे दर्शकों को, हम बिल्कुल नदी के बीच में हैं, कि आप अपने मेहंदी घाट पर आप एंट्री लिखते हैं?
हाँ, हम एंट्री करते हैं।
अच्छा, ये बताइए कि कब, कितनी देर हो गई आपको यहाँ काम करते हो?
हमको हो गए करीब 8 साल नौकरी करते।
8 साल, तो इनको 8 साल हो गए हैं। तो 8 साल में ये देख रहे हैं कि किस तरह यहाँ पे हालात हैं, और आज और उन 8 साल में क्या फ़र्क है। तो सबसे पहले मैं आपको पूछूंगी कि हमने देखा मेहंदी घाट पर कि मतलब हंड्रेड्स ऑफ बॉडीज़ जो रेत में डली हुई हैं, ये कितने दिन से ऐसा सिलसिला चल रहा है?
ये अभी करीब 4-6 हफ्ता पहले से मतलब ये सब जब
चल रहा है, कोरोना के
टाइम से चल रहा है। और पहले मिट्टी 1-2 दिन में गाड़ दी जाती थी, जो मतलब बच्चे, छोटे बच्चे हैं या जिनकी शादी आदि नहीं हुई थी, वो लोग गाड़े जाते थे। और अब तो काफ़ी मिट्टी है, भीड़ के चक्कर में जगह नहीं थी, तो मतलब रात हो जाती तो भी आदमी भाग जाता घर में।
ये आप समझाइए, आपने कहा कि पहले, क्योंकि कुछ लोगों ने कहा कि पहले भी ऐसे रिवाज थे, आपने कहा पहले बच्चों के साथ होता था,
हाँ,
बिकॉज चिल्ड्रन आर नॉट क्रिमेटेड, या किसी की नई शादी हुई उसके साथ होता था। तो ये रिचुअल समझा रहे हैं, क्योंकि आपने शायद देखा होगा सरकार के कुछ लोग कहते हैं भाई ये तो पहले भी होता था, लेकिन पहले जो होता था वो छोटे बच्चों के साथ होता था, या फिर जिसकी नई शादी हुई।
हाँ।
अब जो आप 4-6 हफ्ते से यहाँ देख रहे थे, क्या होता था? लोग आके बस छोड़ जाते थे?
छोड़ जाते, जगह ही नहीं है, भीड़ इतनी, वहाँ से लेके यहाँ तक तो मतलब भीड़ इतनी, 150-200 मिट्टी।
मैं आपको दिखाती हूँ कि हम ये उस घाट से हम कहीं दूर आ चुके हैं, वो वहाँ मेहंदी घाट है जहाँ पर रेत में, और वो तस्वीरें हम आपको ऑलरेडी ग्राउंड से दिखा चुके हैं और दोबारा भी यहाँ पे आपको दिखा रहे हैं कि रेत में बॉडी छोड़ जाते थे। अब आप मुझे बताइए कि अंदाजन एक दिन में, क्योंकि मैंने तो यहाँ पे मतलब गिनती मेरी बंद हो गई,
हाँ।
एक दिन में कितनी आप देख रहे हैं मिट्टी आते हुए? पिछले 4-6 हफ्ते?
पिछले 4-6 हफ्ता पहले तो यहाँ पे बहुत पोजीशन खराब थी, 200, 150, 250
दिन में,
लगभग
एक दिन में
इतनी डेड बॉडी आती थी, और मतलब इतनी भीड़ थी जहाँ पे मिट्टी जल नहीं पाती थी, तभी आदमी छोड़ के चले जाते थे, क्योंकि माहौल बहुत खराब था।
तो ये बता रहे हैं हमें मयंक कि ऐसे भी दिन इन्होंने देखे हैं जब एक दिन में 200 से अधिक बॉडीज यहाँ आ रही थी और उनको छोड़ दिया जाता था। ये कहाँ से आ रहे थे लोग?
जे 4-6 जिले लगते हैं, एक तो कानपुर देहात हो गया, एक औरैया हो गया, एक हरदोई हो गया, एक लखीमपुर खीरी, और लखनऊ और कन्नौज।
इतने दूर दूर
से लोग आ रहे थे।
रात को आते हैं ज्यादा?
रात को आते थे 8 बजे 7 बजे तक, और सुबह 6 बजे 5 बजे से मिट्टी आना शुरू हो जाती थी, रात में 8-9 बजे तक मिट्टी आती रहती थी।
आपका क्या अंदाजा है कि 4-6 हफ्ते में यहाँ कितनी मिट्टी आई होगी?
4-6 अंदाजा में आई होगी करीब 1500 मिट्टी आई होगी।
तो ये बात कर रहे हैं कि एक ही घाट में 4 से 6 हफ्ते में 1500, मुझे लगा इन द हंड्रेड्स हैं, ये 1500 बॉडीज एक घाट पर बात कर रहे हैं। एक और मैं आपको सवाल पूछूंगी कि ये क्या माहौल है कि लोग छोड़ के जा रहे हैं? किसी को मालूम नहीं इन बॉडीज़ का नाम क्या है, इनके साथ कौन परिवार जुड़े हैं, क्योंकि एक तरफ तो जहाँ अंतिम संस्कार हो रहे हैं वहाँ परिवार वाले हैं, वो ठीक है, लेकिन जो रेत में छोड़ दिए जाते हैं, ये क्या है? ये इनके पास पैसे नहीं है कि ये कोरोना की एक तरह से डर गए हैं कि भाई लोग क्या कहेंगे?
भाई जनता जो कहती है कि मतलब पैसे नहीं है, और मतलब दूसरी बात की भीड़ है, चलो इससे ठीक गाड़ दे वही ज़्यादा ठीक है, और पैसे नहीं है, और कोरोना के टाइम मिट्टी जली है तो 3 घंटा लगी है, और भीड़ भाड़ हुई तो और मतलब बीमारी बढ़ी है, इसे एक डर की वजह से मिट्टी गाड़ के कुछ लोग चले जाते हैं।
तो कोरोना के डर से?
कोरोना के डर से।
अच्छा, अगर मैं आपको पूछूं कि जब कोरोना की गणित की जाएगी हमारे देश में, तो इन बॉडीज़ को कौन गिनेगा? कोई गिनेगा? कोई गिनती है, कोई नाम है, कोई हिसाब है?
इसका कोई हिसाब नहीं लगा सकता कि कौन कहाँ से आया और कहाँ गाड़ के चला गया।
इसका कोई हिसाब नहीं लगा सकता, और दूसरी बात है कि इसको हिसाब लगाने की कोशिश भी नहीं की गई। मयंक भाई, 8 साल आपको हो गए हैं इस घाट पे काम करते हुए, कभी आपने ये हालात देखे हैं जो आपने 406 हफ्ते में देखे?
ऐसा तो हमने कभी नहीं देखा है जैसा ये हुआ है 2-4 हफ्ता पहले। अब लेकिन फिलहाल
थोड़ा बेटर हो गया है।
हाँ।
ये इन्होंने जो 4 से 6 हफ्ते में देखा, इन्होंने पहले कभी नहीं देखा। ये कहते हैं 1500 ऐसी बॉडीज आ चुकी हैं विच हैव बीन अबैंडन्ड। तो जो डिनाई करना चाहता है वो यहाँ आकर हालात खुद आंखों देखा हाल मयंक से आप सुन लीजिए और आपने सुना भी। और सुभाष भाई से बात करते हैं जो हमारी नाव चला रहे हैं, जो हमें लेके जा रहे हैं इस 30 किलोमीटर के सफ़र पर गंगा नदी के किनारे। सुभाष भाई, आप क्या देख रहे हैं? आप तो ऊपर नीचे आपकी कश्ती जाती है, पिछले 4-6 हफ्ते में क्या देख रहे हैं आप?
मैम, हमने अपनी ज़िंदगी में नहीं देखा इतना, जितनी अब बॉडी देखी इस वक्त। और यहाँ बॉडी देखते खन मेरा घबराहट होने लगी। मैंने अपनी बोट भी बंद कर दी।
बोट बंद कर दी?
और क्या,
मतलब इतनी घबराहट हुई?
हाँ, इतनी लाशें अपनी ज़िंदगी में देखी नहीं मैंने।
इतनी लाशें अपनी ज़िंदगी में देखी नहीं। और ज़्यादा क्या देखा कि लोग छोड़ के जा रहे?
छोड़ के, हाँ मैम।
कब आते थे?
ये दो हफ्ते हो गए आगे।
अच्छा।
हाँ।
और रात को आते हैं? ज़्यादा
रात को भी आते थे।
अच्छा। और जिस घाट पे हम जा रहे हैं वहाँ पे भी उतना ही बुरा हाल है?
इससे ज़्यादा वहाँ भी है।
और वही हो रहा है?
हाँ,
रेत में छोड़ के जा रहे हैं?
जा रहे छोड़ के।
क्या लगता है आपको कि क्या हो गया इस बारी?
मैम, पता नहीं है क्या हो गया। इससे तो अब आदमी की, सबके संसार में एक ही बात है कि पता नहीं ये क्या हो रहा है।
यहाँ कोरोना को लेके गाँव में कुछ टेस्टिंग वगैरह की बंदोबस्त है? किसी के टेस्ट हो रहे हैं कोरोना के?
अभी तो नहीं हुए हैं।
आपने कराया कभी कोरोना का टेस्ट?
अभी नहीं कराया।
आप कराना नहीं चाहते?
क्यों नहीं, अगर महसूस होगा तो मैं बस कराऊंगा।
गांव में लोग मास्क पहने हैं क्योंकि
हाँ।
आप नहीं पहने?
मैडम, अभी मेरा ये टूट गया है।
अरे, दुपट्टे के साथ कवर कर लो।
अच्छा,
है ना, कवर कर लो, वही अच्छा रहेगा आपके लिए भी। पर आप ये बता रहे थे लाशें अपनी जिंदगी में नहीं देखी। आपको कितना साल हो गया यहाँ पे?
कम से कम जब से मेरी, ये समझ लो 30-31-32 साल में हो गए हैं।
32 साल में आपने कभी ऐसी बॉडीज
कभी अपनी लाइफ में नहीं देखी ऐसी।
कितनी देखी होंगी आपने?
अरे मैडम, बस कहो ना, हम तो देखा थे पूरी लाइन के ऊपर लाइन, एक फूकना ही पाए, दूसरी वहाँ फिर चालू।
और आपको इतना घबराहट हो गया आपने अपनी बोट बंद कर दी?
सबरी बंद हो गए। हमारी लोगों ने 7 बोटें हैं, 7 बंद हैं।
क्यों?
क्या कर रहे हैं,
मतलब इतने?
हाँ,
मन नहीं हुआ?
बस यही मन हुआ कि कहीं शांति जगह निकल जाओ, जहाँ मनुष्य का नाम ही ना हो।
बिल्कुल दिल से बोले कि ऐसा मन हुआ कि कहीं निकल जाओ जहाँ मनुष्य की नाम ही ना हो, क्योंकि इतने सुभाष भाई बॉडीज देख चुके हैं।
Right, that's an excerpt from our journey down the Ganga. That full story is available on our channel. But operatively, for anyone who didn't understand Hindi, both of those testimonies actually speak to the fact the boy who does the registries at the cremation at the ghat, and the boatman, that in their lives they've never seen so many bodies. The reason I bring this up is because the government is arguing that the second wave is receding. They have responded ferociously to any suggestion that the death rate is being undercounted, whereas all objective assessments say that those fatalities could be undercounted by a factor of not 3 or 4, but now by 10. Let me introduce our guests on the program and we'll get into the conversation. Dr. Ishwar Gilada, old friend at the front line of the COVID battle from Mumbai, is with us. Dr. R.K. Mani, welcome back to the program. Always a pleasure to learn from you. Dr. Bajan from Mumbai, part of the Maharashtra task force, in particular focused on children. Thank you for joining us. We're also joined by Dr. Raghuraj Hegde from Bangalore. A very important perspective from him on black fungus. He's been tweeting almost every day about how that might well be the next crisis. And I do want to understand a little bit about that because, this crisis isn't over yet. And from the United States today, we're joined by Professor Bhramar Mukherjee, one of our foremost modelers. And I'll start with you right away, Bhramar, because the last time we were speaking, and I think it's been about a couple of weeks now, almost a fortnight. A fortnight ago, you said that 1.2 million Indians, and you said that was a conservative estimate, had already died. I don't know where you would place that number today. And given what your own numbers suggest, whether you are comfortable with now an official announcement that declares the second wave to be receding.
Thank you, Barkha, and thank you for your journey across India and bringing truth to us. It is really very heartbreaking to see the reality on the ground, and no ever number, reported or unreported, can do justice to the reality. That's a fact. So our calculations, and again, I always try to make very modest estimates, not really extreme estimates, which could also be true. And the paper just went live on medRxiv, estimates about 492 million infections in India as of May 15th. That's
492 million infections.
Yes, and wow. About 1.21 million deaths. And that's conservative estimates. That sort of shows that 36% of India has been infected, and it's total cumulative. And we also break it up into wave 1 and wave 2. And we distinctly see that the underreporting is much more acute in the wave 2 phase. I'll give it some benefit of doubt because sometimes the death numbers come in late. And so we do not know the wave 2 picture completely. We have only up to May 15th. We do not have data from the declining part of the wave. So that will change our calculations. But that's where it stands. And that is why the mathematical model projections are out there. And many.
Can I ask you to repeat the numbers, because I want to actually take them on our banners as you say them. Can I ask you to repeat them?
Sure.
How many infections?
So we estimate about 492 million infections in India up to May 15th. And we estimate...
so 492 million, right? Yeah.
Yes. So that gives you, and at that day, May 15th, India was reporting 24.8 million cases. So that gives you an underreporting factor of about 20 for cases.
So an underreporting factor of 20. Wow. Okay. And then on the deaths?
On the deaths, we get an estimate of 1.2, around 1.2 million deaths, again up to May 15th, when the reported numbers were 270,000. So giving us about underestimating factor of 4 to 5. And again, the estimates that we put forward are actually conservative estimates. You saw the New York Times tracker where many experts actually gave other opinion. People have looked at relatively restricted excess death data comparing this year's 2020 deaths with 2021 deaths with 2019 deaths, because we do not have a comprehensive snapshot. And so with that, our estimates are conservative, but the mathematical model, the assumptions, everything is in that paper. And I welcome criticism. I welcome feedback on those numbers.
Now, underreporting of cases by a factor of 20. What about the underreporting of deaths? What does your factor, throw up there?
Yes. So on May 15, 270,000 deaths were reported, and we estimate it to be at a 1.2 million. So you see that it is 4 and 5, right?
So underreporting by a factor of 4 and 5, according to you.
Yes.
So not as high as some of us are arguing it is on the ground.
And again, based on the reported data and certain assumptions, we applied, like I tried to be very, very conservative in terms of making those assumptions that you need in the model. And wave 1 and wave 2, even if you use the same parameters, same settings, you get an inflation, an acute number in wave 2. Yes.
So when you hear the comment about the second wave, you would say what? And then I'll open it up for discussion. Those numbers were important and they give us something to talk about. When you hear the government say that the second, and some numbers by others have been much more dire. For example, Ashish Jha argues that India is missing infections. He thinks we're missing 80% of the infections. You're saying underreporting of cases, factor of 20, underreporting of deaths, factor of, let's 4 or 5. What does that do to your estimate of where the second wave is?
So, I do believe, and the experiential evidences that you are listening to, that the peak has passed. The peak has passed. It was 2 to 3 weeks ago, 4 weeks ago, things were more extreme. And people also are saying that. On the ground, folks are also saying that. But are we out of the woods yet? I do not think so. So that concept of the national peak continuously makes me feel a little anxious, because it might give everybody this false sense of security that the crisis period is over and we are going to be complacent with our, how we are gearing up, scaling up COVID care systems and oxygen production again, because there are states where it is still not safe. I would say that, Tamil Nadu, Andhra Pradesh, Karnataka, West Bengal, still we have to watch the situation very carefully. There is a cluster emerging in the northeast. There is Goa. There is Lakshadweep. So no one is safe until everyone is safe. So we have to be very cautious. And that's why this sort of image that we are out of the woods really concerns me, because there is so much heterogeneity across the states.
Yeah, and I think Ishwar Gilada has also been making that point that every state has a variation. But these numbers are very important, Dr. Gilada. Underreporting by a factor of 20 when it comes to infections, underreporting by a factor of 5 when it comes to deaths. And I know Bhramar to be quite conservative. My own experience from the ground would tell me that those factors could be higher, but these are conservative, cautious estimates of where the underreporting would be. Dr. Gilada, when Dr. Paul goes on record to say the second wave has stabilized, even when the restrictions are open, we expect it to hold. From your experience, what would you say, Ishwar Gilada?
See, what I would like to say that in the southern part of the country, including Maharashtra, the factor can be for every infected case, there are 10. If you apply Bhramar's calculation here, then a number of infections will in Kerala or Karnataka or Tamil Nadu will be more than the population. So if we look at anyway, death records and other figures in southern part of the country, they are better. So the factor of 1 is to 10 as far as cases are concerned. But as far as northern part of the country is concerned, it may be 15, not 20. So if we think that almost 2% of the population is infected, then if you multiply by average 12.5 or 15, it will become almost 30% of the population is infected. And that's what is the serosurveillance data also tells. But that was up till last month. 20 to 30% of the population infected in different parts of the country, in different pockets, in different populations. Now, secondly, as far as deaths are concerned, again, there are different estimates and guesstimates. Deaths, as of now, today, we can consider in southern part of the country, for every one death, there is another death happening. And that is actually not a very difficult task to do that. You take deaths happen in 2019, 20, and 21 and compare the gap. And in that gap, there may be some comorbidities or collateral deaths happening because of other illnesses, but mostly those deaths are because of COVID. But in northern part of the country, particularly things we are showing in UP and Bihar, the factor may be much more. I do not know how much, but it is definitely much more than what you are recording.
But that is what I wanted to ask Bhramar, and then I'll go to Dr. Mani. How do your numbers factor in what's happening in rural India? Because my experience of the villages, and I went from the east to the west of UP. In every village I went to, the villagers would say that 30 to 40 deaths have taken place in 1 month. And of those 30 to 40 deaths, almost 38 out of 40 did not reach hospital. Now, because 38 out of 40 did not reach hospital, there is no certification. So there is no counting. So I'm just trying to understand, how do your numbers factor in rural India? Can we unmute Bhramar, please? Yeah.
Yeah, so that is something that, we cannot really.
Yeah. Go ahead.
Yeah, that is something that, that is unobservable data. So we cannot really capture that. And even in excess death calculations, it's hard to capture because many deaths, even under normal circumstances in India, in rural area, where deaths happen outside hospital, do not get medically recorded. So even the historical data is limited. But also like to add that our calculations give the seroprevalence surveys that were quoted, if correct, our calculations tells right now, as of May 15, 36% of India is infected. And that's very consistent with the seroprevalence surveys. And that gives you a nationwide estimate, if you just do the numbers, an underreporting factor of around 20. There is lots of heterogeneity across the states, and we also present the figures for different states as well.
Okay, Dr. Mani, obviously the cities are feeling a little less slowed. The villages is a different story. But we have learned, or we should have, from February to not, and the triumphalism that brought us here, that we should not declare anything over too soon. What would you say, sir?
I think what we don't see or measure, we don't understand. And so we can't take action. I worked in Mathura for 4 years, and I know the vulnerabilities of the population there. It's very fragile. The healthcare system is extremely fragile. The testing facility, the treatment facility is very compromised. So in a situation like that, even in normal circumstances, it's very easy to undercount the disease burden, undercount the deaths. ICMR said that only 15% of deaths are properly certified. Now, 15% is in hospitals. What happens in the homes? Well, I think it's staggering. Now, truth may be somewhere we don't know exactly, but certainly we are in a process of self-deception if we believe that this is waning away. We had a staggering peak of 4 lakh plus of incidents a day, and today it's 1,75,000. It's still the highest in the world as of days count. So we may have scaled a big peak and may have maybe settling to a plateau which is still very high. So we cannot be complacent, saying that it's all over. When I walk into the ICU, I do see the ICUs are full. The less sick people are less now, but the ICUs are packed and they are extremely ill. I think young people, there is a lot of burden in the young people, a lot of mortality in the young people, and mortality can extend. What I'm saying is acute mortality is followed by a sort of a longish course of long COVID, and they get negative, COVID negative, and yet they go on to develop difficult disease and then even death. So they may be counted wrong as well. There are many reasons why they can be undercounted. And one of them is this, that you may be counting many of the manifestations of COVID as non-COVID. People can come with heart attacks or strokes, or they may come with a long COVID disease and die of the consequences of COVID, late consequences of COVID. So I think if we don't understand where all the gaps can be, we can grossly undercount. Another major problem is we only talk about the numerator, not the denominator. This is the incident, this is the death, under what context? What is the level of testing being done? What is the accuracy of the certification being done? Without that, how can you compare? And that may be very heterogeneous across the country. You say Maharashtra has high incidence, UP has low incidence. I'm skeptical. It may be similar.
I just want to ask Bhramar, and then I'll come to Dr. Hegde and Dr. Bajan. In your model, how many untested cases are you factoring in for every one that's tested or reported?
So in the beginning, it's an ascertainment rate function. In the beginning, we assume that for every detected case, there is 3. But then we estimate it based on the data, and it changes across time as well. So the number that I'm giving you is in terms of cumulative, right? If we are reporting 25 million cases as of May 15th, the model tells that there are nearly 490 million infections. So, but they sort of follow the same trajectory.
Yeah. Okay. Dr. Hegde, I know your big concern is black fungus. Your Twitter timeline has been filled with that. And these are people who recover from COVID, then develop, this, what was a rare infection. And there's a 50% mortality rate for it if they're not given the antifungal infections. Can you talk a little bit about what you're seeing with patients?
Yeah, it's a very unfortunate disease to have, and it's terrible that it's happening. And I have never seen so many cases in such a short duration of time. We used to see about 2 to 3 a year at the most. But now in the last 1 month itself, I have seen about 46 patients counting today. So it's a terrible disease to have, and without antifungal medications, and no matter, if we do all the best things that we can do, it's still about 40 to 50% mortality is there. And without antifungals, without surgery, without any treatment, the death rate is 100%. So it's a
here's my question to you: what would you classify this as a COVID death? Would you classify it as a black fungus death? Because that takes us to what Dr. Mani was saying. Because I'm assuming right now we are talking only about people who have recovered or are recovering from COVID. So they are all COVID positive patients.
Yeah. So your questions to me?
Yes.
Yeah. So these are not being classified as COVID deaths. So because most of them have recovered from COVID and they test negative when they get admission to the hospital. But we are also seeing a few patients who are in the second week of their illness and yet getting COVID-related mucormycosis. So that is also one of the. But treatment takes long. So by the time they are either recovered or they succumb to the disease, they're probably not COVID positive at that time. So they may not be counted as COVID mortality.
Dr. Mani, I think just before I come to Dr. Bajan, this is what you were talking about, that there are complications that spring from COVID or the treatment of COVID. Then you die from something else, then you do not get certified as a COVID fatality.
Yes, exactly. Because a lot of people die of late complications of lung COVID, pneumonia, fibrosis or persistent inflammation, or secondary infections. So the primary disease is COVID. You may die ultimately of a consequence. So classification is important to know the burden. And unfortunately, I think what we have is a crude data, not
Yeah.
nuanced at all, and controlling for these factors.
Yeah. Dr. Bajan, one of the things that Bhramar Mukherjee said today was that she was troubled by all the talk of a third wave when we hadn't dealt with the second wave. And in particular, the third wave is anticipating what may happen to children. Science is divided on this. Epidemiologists are saying there's no science to say that children will be impacted. You have always argued differently. Where are we on the second wave, and why are we already talking about the third wave?
Yeah. So basically, thanks Barkha for asking that. What has happened is in the first wave, we kind of won a victory in October, and we were very happy. We started patting our backs and became complacent, and therefore we led to the second wave. But this time we are much, much more clever, and we know that we will not use those words that we are away from the second wave or the second wave has gone off. Even the first wave had a very thick tail, and the second wave is also having a very thick tail. So unlike UK and US, when in Jan they had the second peak, it just peaked fast and waned off fast within 1 month. But in our case, we have about 3-4 months for the entire wave to peak and then plateau. So we are seeing definitely a decreased positivity rate in certain districts of the India, and we are seeing that many places it is waning. But yes, in Tamil Nadu, etc., it is still on the rise, and therefore we cannot definitely say that the second wave is over. And I would not use those words that the second wave is over. Waves are going to come and go. In fact, certain districts in Maharashtra, I can talk for Maharashtra more, like Amravati, we might even think that the third wave is already started. So I would require everyone to actually request everyone to stop talking about waves and actually look at the epidemiology, the clinical picture, and try to attend to those. Also, talking of waves, we forget the time of lockdown. So whenever we do the unlocking, we probably don't do it right, at least the first time. And therefore, we have a second surge. Now, is that another wave, or is it just the lack of proper unlocking facilities or programs? So I think everything needs to be put in perspective. We are definitely not over the second wave as India as a whole. Yes, in Maharashtra and Chhattisgarh, we probably are in the declining trend, and there are many other districts and states where it is high.
Yeah.
Yeah.
Yeah, Dr. Gilada, do you want to add to Maharashtra? If you just want to add to Maharashtra, and then I'll go to Dr. Hegde on Karnataka.
You see, Maharashtra has reduced the number of infections by almost 1 to 1/3 what it was earlier. But if you look at some districts, particularly entire Konkan like Ratnagiri, Sindhudurg, and Raigad, and entire Western Maharashtra, Solapur, Sangli, Satara, Kolhapur, and Pune, and some districts in Vidarbha and 3 districts in Marathwada, these 15 districts are reporting more than 2/3 of the Maharashtra cases. Maharashtra has 36 districts. So that way, as Bajan was telling, that we cannot talk about entire nation. In the nation, there are different states. In the state, there are different districts. And it will be, but overall, if we talk about country, yes, we are seeing 55% of less numbers of patients and almost 30% less deaths than what we were seeing 15 days back. But number of deaths will continue to be higher because people dying today, they are not dying from today's infection. They are dying from 2 or 3 weeks before infection. And therefore, the death rate will take little longer time than the number of cases. One good thing is that India has increased the testing. So testing has increased by almost 20-25% in last 2 weeks or so.
What about the lack of testing though in villages? I just want to park that as I asked Dr. Hegde about Karnataka, because I am extremely concerned that we are not counting our villages. And I'm sure modelers have done some factoring in, but those deaths are not being counted, infections, there are no testing. So you're not even going to know the cases, which is why Bhramar's model shows you that the underreporting factor is much higher, in fact, than the deaths. Dr. Hegde, what would be the situation today for you? What is the common pattern you see in all your black fungus patients? How often are you having to remove an eye? What are you seeing with relation to COVID in Bangalore?
The actual numbers of COVID cases are receding as per the official data. So we were reporting about 27,000 some a few weeks back. So now it's around 5 to 6,000 from Bangalore itself. And whole Karnataka was reporting about close to 50,000 cases a day. And now it's around 24 to 25, 26,000. So it seems to be receding. But what I would think is that it might be receding in the cities, but it might pick up pace in the other less connected areas, the tier 2 cities and the towns and villages.
And if I may ask you, how often are you having to perform an eye surgery to remove an eye to save a life when it comes to black fungus? How many such surgeries, let's say, are you performing in a week?
Uh, Maybe in a week, I would do about 5 to 6 cases a week. And out of patients who are coming up, maybe about 15 to 20 patients are coming every week. So out of that, about 5 to 6 patients I may have to remove. But the good part about it, because of the awareness now, we are seeing much earlier patients presenting earlier, so that we can save their eye as well as their life. But surgery is just one part of it. The next part is the medicines, and without medicines, it's going to progress. Despite whatever surgeries that we do, it is going to progress, and that is going to be the real crisis in the next few weeks, because we
And
do not have enough.
those medicines are short. That
Yeah, the
antifungal
short,
injection is
short,
short.
yeah, it's short, and every day patients are struggling, running around all over Bangalore, all over the city, trying to get medicines for their
Yeah.
loved
And
ones.
yeah, and I'm really bothered that it doesn't get classified as COVID, and I want to talk a little bit about that with the doctors. But Dr. Bajan, to your point about children, there's been a lot of focus on children. If you just because we have 5 minutes left, so we need to take closing comments. Dr. Bajan, yeah,
Uh,
yeah, you're on mute, sir. You're on mute, sir.
yeah, so you want me to talk about children only, or
No,
as a
anything
whole?
you want to, but as a whole, just
Yeah,
with a
so
little bit of
basically,
focus
I
on
just
children,
want to make
because
two, three
yeah,
points here. One is about the death rate. So the COVID kills in 3 phases, trimodal death. One is just because of COVID, because they come and they are happy hypoxic, and they come and probably drop dead within the first week of illness. The second group, because of comorbidities, etc. The second group would be they develop thrombotic complications, and they do not get weaned off the ventilator. And the third group would be those who have secondary bacterial infections, fungal infections. Mucor would classify there. So in the third phase, when you have sepsis and multi-organ failure, probably this would lead to a lesser number of reporting, because that death is going to be called as a sepsis or a mucor death, and probably because the patient is not anyway positive now, would not be reported as COVID. So that
but
might
are
be
you
one
but are you
factor.
comfortable? Are you comfortable with that? That's my question. Are we comfortable with not counting these as COVID deaths?
Till date, any of the illness, say for example, if we had leptospirosis, and which is a communicable disease, but 2 months down the line, if the patient died of multi-organ failure and sepsis, we wouldn't probably write it as a leptospirosis death. So we are having a pandemic, and therefore, yes, we need to account for that. But I'm just trying to explain that
Got
Professor
it.
Brahma's model could be having this to factor in, because many of the deaths which occur after the negativity of the patient who was positive earlier would be reported as acute stroke or acute MI or multi-organ failure or even mucor, etc.
Okay.
We see a lot of mucor in adults as well. And just a word on that, we at the Maharashtra Task Force, at least, we made a entire dictum on this, and we said that all the patients should be screened even before discharge after COVID, and a good ENT would do an endoscopy before we discharge patients who are 10 to 15 days in a hospital. So we are on the ball for mucor. We are making sure that the sugars are controlled. But having said that, we've used sugars for a long time, steroids for a long time, and we've not seen so much mucor. So the problem is the COVID itself reduces the immunity of a person and leads to the more and more of mucor. So I kind of agree that a mucor death may not be classified as a COVID death.
You agree
I
with that?
I
Okay.
agree with, yeah,
Okay. I'm in the
because it's
last
a
2 minutes of my
secondary
so
infection, but I'm sure everyone would differ with me. Yeah.
yeah, I would differ because I just feel that
Barkha,
when the
I'm one of
original.
the person who will
Yeah,
differ,
Dr.
because
Bani,
I
go ahead,
think,
and then I'll give Bhramar
yeah,
and Dr. Gilada the last word. We've got to
just
quickly wrap
very
up. 2 minutes.
briefly,
Yeah.
when we have causation of death, the underlying cause should be mentioned, not the immediate cause. Immediate cause is one. Immediate cause for everybody is heart stopping. So that can't be the cause.
I mean,
There is
my father died from a heart
cause.
attack. Let me give you my example. My father died from a heart attack, but my father would not have had that heart attack had he not had COVID.
COVID, exactly.
So how can
the
he be counted as a heart
underlying
attack death, right? So
In fact,
it's
officially in the death certificate, we are supposed to fill that. What is the underlying cause or other comorbidities? So
Yeah.
COVID has to come in there. What I'm saying is, see, there are many collaterals due to which people may die of in a pandemic. They may die of hunger. They may die of malnutrition. Now, that's why the excess deaths, which Professor Bhramar has mentioned many times, without that, we can't have a meaningful conversation on the death rate.
Absolutely.
What is the excess death, which will factor in all this, because they are also deaths. There are many people denied ordinary medical care because everything is occupied by COVID. What of them? People who die of MI or people who die of appendicitis because of want of
Actually, it's a great question. And let me ask it to Bhramar in her last comments. Where do deaths from a lack of supply in oxygen get documented? Where do deaths from a lack of access to healthcare because there's COVID and everything is shut get documented? Bhramar, if you want to take that in your last comment.
So thank you. So I think obviously you have to separate the natural clinical lethality property of the virus, where we have lots of data now. What is the true infection fatality rate, even in India, if you could get healthcare, and then what is the excess deaths that are happening, which are quite acute. And that's why we see this difference between wave 1 and wave 2. As my concluding comment, I really would like to see this mortality data that all of us have mentioned, stratified by age and sex and comorbidities, being released historically, so that we can answer all of these questions instead of arguing, because this data should exist. Even in the United States, there were 22% excess deaths. 72% of those were actually attributed to COVID. So this calculation was possible, and we really need to know, because the stories of the dead actually influences the life of the living. Because if a lot of people in the 40s and 50s are dying, we need economic policies to support the families. If there are many long haulers and post-COVID sequelae, we need to maintain the health task force to sustain these people. We need to provide social support, mental health support of families that have been ravaged. So that's why we need to count the life of that have been lost.
Absolutely, that's well said. I have to close. Dr. Gilada, do you want to throw in a line before we close? Just one line?
Yeah, what I would like to say that we need to count all the deaths related to COVID, whether post-COVID, as COVID. If you look at the death certificate, there is clearly mentioned what is the cause of death. Terminal cause of death is cardiorespiratory arrest. Due to what and following what. So COVID comes in everywhere. If we just don't want to go by RT-PCR test showing negative and want to write off COVID, to want to show that your death, your state has very good death rate, a very good recovery rate, I think that is something wrong. And that's the reason that even with 1% death rate, which are shown on paper, there is a high death rate. Otherwise, 1% death rate of what is called CFR and IFR is 10 times lower. So then it is as good as flu. So why should we bother about COVID then? So,
and just to make the point that the number of deaths between April and May, I was just checking the data, even in official data are the same. So the deaths actually haven't come down, even if the cases have, and that's something important, even in that official underreported data. But I think what's important is, for all the disagreements, some disagreements that our experts may have had today, the one agreement is, please do not declare waves to be over. I think that is, the important point. That triumphalism really cost this country. We just cannot afford that complacency again. And we do not know what's going to happen as restrictions are lifted. And that's really important. And then, of course, there are other affiliated public health crises, whether it's black fungus, whether it is those bodies. I really worry about them. The river banks I've been to, the monsoons are coming. We don't know what that's going to do. So many questions. Thank you, everybody, for your time. And we'll keep bringing all of you back as we track the story through the heartland and across India. Thank you to our audience for watching. See you tomorrow, same time, same place. Goodbye.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.